Hello everyone, this is Marjola from the University of Vlora, Ismail Qemali, and I'm going to share with you my video about the study that has to do with the evaluation of the provision of primary health care by patients affected with COVID-19. The importance of the study has to do with monitoring the quality of the primary health service. That is very important, as problems can be prevented and eliminated. This is the only study of its kind in Albania, and seeing that COVID-19 brought attention once again to fix the deficiencies that our health system has. The pandemic reveals problems that no one had paid attention before, and this is important because it measures the level of the primary health care that takes priority, being the first link that connects the doctor and the patient also. The health and the primary health care, according to WHO, health is a state of complete physical, psychological, and social well-being, and just not the absence of the disease of the infirmity. This is the level of contacts of individuals, families, and communities with the national systems, healthcare, by bringing healthcare as the close and possible to people where they live, where they work, and constitutes the first elements of continuous health and care process. Quality and pleasure of the health service. The quality can be reached by the structure of the healthcare centers or healthcare other inputs, processing or content care, outcomes of care. There are two reasons why we are interested in measuring the patient's pleasure. First of all, because the concept of patient satisfaction enables us to view healthcare services from the patient's perspective. And secondly, the patient satisfaction provides a practical tool for identifying problems in care processes and how care is delivered to them. So such problems can be addressed and services can be improved, and what else can be done better. Demographic and epidemiological changes bring the need for health system to adapt to the new health demands to the population. This requires assessing the response of health services from patients. Such assessments generate information about accessibility and convenience of services, how patients are treated by health personnel, how patients perceive information and communication about their condition, and they affect their behavior and well-being. And finally, how well their care is managed and the primary care level is beyond of them. The functions and objectives of the World Health Organization health system is the functions of the taking care, the care, generating the other sources, finances, spreading them, and the objective that are reached in health system care is responsibility, the financial contribute, and the result is health. The determinants of patient satisfaction in healthcare assessment in service quality has to do with the model of Donabedian that suppose and gives us the existence of three factors that are main factors by assessing the quality, the structure, and the process and the result. And maybe it's another link between them, an important link between them. The structure had to do with the staff, equipment, instructions, and supplying. The process has to do with interconnection, investigation, examination, and treatment. And the result has to do with morbidity, mortality, and the pleasure of the patient. Staffing needs in healthcare centers. Information and preparing for development. The personnel of health centers need knowledge, skills, and continuous professional development of opportunity to improve the quality of service that they offer. and supply equipment and infrastructure also need necessary equipments, instruments, infrastructure to ensure their uninterrupted and high quality provision of health services. And also the support is supervision, the personnel that works there, the environment that they create to give the health care service. And also the communication is very important. It depends this on the level of the service that they offer. The presentation of the study. The aim of the study is to evaluate the patient experiences while receiving health services in health centers among patients who receive services during COVID-19. And the general objective is to evaluate the provision of health services in primary health care. Specific objectives: evaluation of the relationship between the level of satisfaction and the quality of the primary health service. And the next one is to analyze the hypothesis of the work through the statistical data obtained from the processing. As you can see, the hypothesis has to do with the quality of the service depends on the time of receiving their service. Young people are less satisfied with the service of the health centers. By receiving the health service at the center, it was easy to get a recommendation. And the next one, gender has not affected the provision to the service. The methodology used this study is a cross-sectional study based on evaluation of the provision of the health services received by the patients of the hospital. 110 questionnaires were completed out of a total of 1,000 population. A self-administered questionnaire was used in the March-June period. A standardized questionnaire with free access online was used. Also, this study has some excluded criteria. The administrative personnel and the medical staff working in the selected health institutions are not included. So the finding in the study, 5.5 were unemployed, and the majority of the sample consisted in the number of students. 10% were employed in the private companies, while the other part work in state. There are 43.6 between ages of 17 and 24. About 48% are married, and more than 82% live with relatives. They have an education of high school in about 17%. 53% of patients have done university studies. Most of those who have only 8 to 9 years of education and high school claim that they receive the health service at the right time. Those who have higher level of education, bachelor or master degree, state that they did not receive the service of at the right time. The level of education affects the assessment of the health service that they received. For 56.4% of the patients, the health institution has a moderately accessible distance, a very distance for about 34.5% of the sample. 9.1% of the patients claim that the location of the health institution is too far from them, while the other percentage does not claim such a response. Reaching the health system, as you can see, they claim that it's reachable, quite reachable from their houses to the health center system. Satisfying in the receiving the service, 52.6% of the patients express that they are not all satisfied with this service. 16.4% feel a little satisfied, and 7.3% are somewhat satisfied. Only 15.5% of patients expressed satisfaction, and only 8.2% felt very satisfied. The majority of the patients, namely 55.5%, state that they are not all satisfied, which means that for them the health health centers' care does not give them the necessary facilities for the health service. We have a variety of answers here, as only 3.6% are slightly satisfied and 20% are somewhat satisfied. From the patients who have expressed that they are dissatisfied, most of them have a bachelor or master level of education, which lets us know and explain that higher the education, less is the satisfaction in these patients. Also, 72.7% of the patients stated that there were no differences in the provision of centers dependent on the gender of the patients, which give us some notes that our hypothesis claimed for gender discrimination is not approved. Among the group of the employment, most of them affirmed that the quality of service varies according to status. We also noticed that this is the group of pensioners, the persons that are retired, while all patients who work in private companies state that the quality of health service does not change. The health service has more immediate in the older age group. And while the majority of patients belonging to the age of 17 to 24 years and 22 to 54 years affirm that they received later the health service compared this to the other age group. 55% of the patients' health care service provides that they never came to the apartment, and 33.6% claim that sometimes, and for the other percentage, the health service providers always come to their home. 63.6% answered that it took more than 15 days to receive the health service care. Those who received housing service belong to the age group of 55 to 64 and over 65 years old, while the most of the other ages group receive it was missing or they received it in the healthcare centers. The discussion of the study, patient satisfaction with the service is predicted by factors related to care, sensitivity, reliability, and responsiveness. Identify dimensions that influence patient evaluation, including behavior, service availability, continuity, trust, efficiency, and outcomes of health centers visits. On the other hand, our study also highlighted the fact that the majority of respondents who belong to the group age of 55 years old were most satisfied with the service they received. The same is also confirmed by a similar study done in Albania. Not in this field, but about measuring the pleasure of the patient in intervened in hospital. Another service evaluation study shows that the younger, less educated, merit and lower satisfaction. The study showed that the demographic factors strongly influence the evaluation of the service and no changes from literature. There are no studies on the evaluation of the primary health care for persons who were with COVID, and for this reason, this is a special type even in the wider region as a study which takes time to be carried out. And I think that it should be defended with a larger sample and in scope. About the hypothesis, 63.6% answered that they took more than 15 days to receive the healthcare service, which means that hypothesis number one is accepted. After receiving the health service at the center, it was easier to get a recommendation. The study pointed out that receiving the service became a bridge to prevent. Most of the respondents reported that they did not receive a direct recommendation, and this means that the hypothesis number three is not proved, and 80% think that gender does not affect the provision of the service. The patients of the study affirmed that they received health care at the same time. And the level of the patients that have master degree or bachelor in education, they did not receive on the right time they did not receive on the right time the healthcare service. So the level of education is affected by thinking that they did give or not a right health service. More higher age group, the patients are satisfied with the health service, and the study show that half of the patients are not pleased with the service they took from the healthcare or primary healthcare. It is necessary that the patients take the right information about the services they get, and it should be improved the service and the quality of healthcare by taking into consideration the level of pleasure as a main factor in patients. The health personnel staff should be part of trainings and seminar in different fields, and especially in communicating and giving the right behavior through the patients. It should be aimed that the group age of from 30 to 60 years, they take the right interventions by taking care in healthcare system, by seeing that the study approved that this age group is less pleased with the service that they took in this primary health care. By improving the also the identified challenges, by offering this kind of training and continuity through this group age that I claimed before. Thank you for your attention.